As Alan mentioned earlier, the distribution of lesions in atopic dermatitis can change based on the patient's age. In infants, we typically see disease activity located on the face, scalp, trunk, and extensor surfaces of the extremities. As children get older, the disease tends to manifest in the flexural folds, including the antecubital and popliteal fossa, as well as around the neck and ankles. In adults, we tend to see atopic dermatitis on the arms, the back, wrists, hands, fingers, feet, and toes. When you're looking at atopic dermatitis disease in the skin, you should consider these four main categories when you're assessing the skin lesions. These include erythema. Mild atopic dermatitis tends to have faint erythema or more of a pink appearance, while more severe lesions tend to develop a darker erythema. Very severe atopic dermatitis can present as erythroderma, which is diffuse redness of the skin covering at least 90% of a patient's body surface area. You should also look for xerosis, as this is a hallmark of atopic dermatitis. Lichenification may or may not be present. Mild lesions may show no lichenification at all, whereas severe lesions may have significant thickening of the skin that results from repetitive scratching or itching by the patient. And finally, excoriation. Mild lesions may have few to no excoriations, while severe lesions may have extensive bleeding and even ulcerations from excoriation. On this slide, we can see some classic atopic dermatitis skin lesions. It's important to understand how atopic dermatitis can appear based on a person's underlying skin type. You can see here the picture on the left shows a patient with Fitzpatrick 1 or 2 skin type. Here you can see a pale pink lichenified plaque on the antecubital fossa. The picture in the middle shows a lichenified lesion of atopic dermatitis in a patient with a darker skin type. And finally, the picture on the right shows a more severe lesion of atopic dermatitis with the deeper erythema that we discussed earlier, as well as accentuated skin markings. As Alan mentioned, you can get atopic dermatitis on the face. The classic findings of facial skin involvement include perioral skin involvement, periorbital skin, and periauricular skin. Oftentimes, patients with atopic dermatitis that have involvement around the ears may get a fissure, which is shown here in the upper picture on the right.